Excellent. Folks are joining. Good evening, folks. Just a few more minutes to kick in. Give it another minute or so before we get started. Excellent, excellent. I'm going to get this started by saying hello. My name is Tykee James. I'm with Conservation Colorado, and I would like to pass it to Carla from CLC with an important announcement.
Hello, everyone. My name is Carla Rubalcaba. I am with the Community Language Cooperative. Today, we practice in language justice to make sure that everyone has an opportunity to speak and listen in the language they feel more comfortable with. To do this, we will use simultaneous interpretation between Spanish and English. So I will say this in Spanish, and when I finish, we will turn on the interpretation feature. So you will see like a little world map in the corner of your screen, so 3 dots, depends if you're on a computer or in a cell phone. Pretty much look where it says interpretation and the word more, so you can select the language you would like to hear. I also recommend that you click where it says mute original audio so you don't hear both languages at the same time. If you only speak English, please choose English. Since I'm going to be interpreting from English to Spanish, Spanish is kind of like 15% longer than English, so it will take a little longer to interpret. Please try to stretch your words when you speak and make sure that you mute your audio when you're not speaking so I can only hear the person that is speaking and everything gets interpreted properly. Before we start, I would like to remind that everything that you said is going to be interpreted, and of course, it will remain confidential. If you have any questions, you can send me a message. Now, I'm going to say this super fast in Spanish so we can start. Give me 1 second. Hola a todos, mi nombre es Carla Rubalcaba y trabajo con Community Language Cooperative. Hoy practicaremos lo que llamamos justicia del idioma para asegurarnos que todos tengan la oportunidad de hablar y de escuchar en el idioma en el que ustedes se sientan más cómodos. Para ello utilizaremos la interpretación simultánea entre español e inglés. Lo que ustedes escucharon hace un momento fue esto mismo, pero en inglés. Al terminar mi introducción, activaremos la función de interpretación y van a ver ustedes un mapita en la esquina de sus pantallas o 3 puntitos. Depende si están en computadora o en un celular. Más que nada busquen donde dice interpretación y donde dice la palabra more, que significa más, para que seleccionen el idioma que ustedes deseen escuchar. En este caso, pues vendría siendo español. También les recomiendo que le hagan clic en donde dice Mute Original Audio, que significa silenciar el audio original para que no escuchen ambos idiomas al mismo tiempo. Antes de comenzar, me gustaría recordarles que todo lo que se diga será interpretado y se mantendrá confidencial. Si tienen alguna pregunta, pueden mandarme un mensajito y comenzamos en unos segundos. Gracias. I believe we're all set up, so interpretation begins now.
Thank you very much, Carla. Incredible, super helpful. We're very happy to have you. And we're also very happy to have our partners that help make this possible. Thanks to Moms Clean Air Force, Healthy Air and Water Colorado, and Adams County for working together to bring this educational webinar on this pretty complex topic that I'm really happy that we have some really enthusiastic, really smart folks to help break it down and talk about what we can do to help. These speakers, again, I will say my name. I am Tykee James. I am with Conservation Colorado. I am their Senior Environmental Justice Campaign Manager. I am joined by Dr. Tehya Stockman from Adams County, as well as Dr. Maria Chansky and Shaina Oliver, Shaina being from Moms Clean Air Force. And today we will learn about air pollution in Colorado. If you signed up to learn about air pollution, well, hey, we're about to jump into that. We're also going to understand the rulemaking process, why it's important that we understand how it's happening is part of that context. We're going to recognize those health impacts of air toxins, hearing directly from a human health professional, Dr. Maria, which would be great. And we will also learn how to take actions to advocate for cleaner air in Colorado, finishing strong with a call to action. And with that, I would like to introduce Dr. Tehya Stockman, an air quality and policy program specialist for Adams County with a PhD in environmental engineering. She has worked with community groups for a while doing this kind of work. I'm always happy to work with you, Tehya. The stage is yours, please.
Awesome. Thank you so much, Tykee. And as Tykee said, we are really learning about air toxics today in Colorado. Next slide, please. So with this, we have to really understand the rulemaking process, and the call to action at the end of this will really be informing everyone on the call how they can participate in the rulemaking process if you would like to. So in 2022, the state of Colorado passed House Bill 22-1244, which was designed to do a whole bunch of protections about air toxics in Colorado. It really led to this adoption of the rules under Regulation 30, which originally passed in January of this year to identify 5 priority air toxics. And now what we're talking about are the health-based standards for those 5 air toxics. So not just what those air toxics are, but what levels people may experience health risks at, so we can better keep the communities safe from these specific air toxics. Next slide, please. So with this, there was an original list that the Air Pollution Control Division created of over 450 air toxics. In April of this year, that list was narrowed down to about 350 air toxics. So when we're talking about this rulemaking that's happening coming up in September, we're talking about 5 air toxics that were prioritized because they exhibit the highest health risks, according to the Air Pollution Control Division, out of all of the 350 air toxics that the division analyzed and modeled across the state of Colorado. And they really prioritized air toxics that had high cancer risks and high other respiratory or other health risks as well. What they did was they ranked these across the state. So it really went from this whole 400 down to about 40. And then with those 40, it took a lot of effort to get it down to the top 5. What was really cool was in the rulemaking in January, a lot of community input shaped the list of air toxics. So we want to continue the support of an additional community engagement in this current health-based standards rulemaking, because we want to ensure that they're as health protective as possible. So there were quite a few air toxics. There are 5 air toxics chosen. One of which is benzene, which was benzene and hydrogen sulfide were specifically chosen based on community input, and as was formaldehyde. So really, we see the Air Quality Control Commission listening a lot more to the public than they have in the past, and really listening to community voices. Next slide, please. Just to go over what the 5 air toxics are, we have formaldehyde, hydrogen sulfide, ethylene oxide, hexavalent chromium, and benzene. So formaldehyde, it's a bit of more complicated air toxic because It's produced from a variety of sources, including from building materials. So if you ever have headaches in your house, if it's brand new, it could actually be from formaldehyde off-gassing from building materials and furniture in your house. It's also a big component of wildfire smoke, cigarette smoke, a lot of different fuel combustions, and consumer products. Additionally, formaldehyde is complicated because, very similar to ozone, it actually can form in the atmosphere due to reactions with other compounds. So a bunch of chemical reactions can happen, and that can also form formaldehyde. The next one, hydrogen sulfide, is in Colorado specifically, it's mostly from oil and gas operations. However, hydrogen sulfide is the thing that has that rotten egg smell. And what you'll really notice that smell around is anything that has decomposition, composing of materials. So that's landfills and water treatment plants also have a really high off-gassing of hydrogen sulfide. Ethylene oxide is high in a few communities in Colorado, and it's really almost entirely from medical equipment sterilization. But in Colorado, it's also used in our we have a big brewery industry here, so sterilization of bottles can also use ethylene oxide. Hexavalent chromium is really used in a lot of metal manufacturing. So it's particularly high from things that involve like welding and other high heat metal operations. So if you are close to a machine shop or work at a machine shop, you could be exposed to hexavalent chromium. And then benzene, the final one, is mostly from very similar to formaldehyde, emissions from combustion. So that could be oil and gas operations, vehicle exhaust, industrial manufacturing, and then also a big one is wildfires as well. Next slide, please. So just went over the actual air toxics that we're talking about. So, we're only talking about 5. And the reason why these 5 are so important is because Colorado has never developed any sort of standards for air toxics before. So how they're setting the top 5 air toxics is also how they plan to set future air toxics. So really, what is a health-based standard? That is the most important part of this rulemaking, besides knowing what air toxics we're talking about. And it is defined in state legislation as chronic exposure limits for each priority toxic air contaminant, so the top 5, required to protect public health from adverse health effects of that priority air toxic, allowing for an ample margin of safety and represented by a benchmark numerical concentration in the air. So there's a lot of different words baked in there. One of the things that us at Adams County Conservation Colorado Moms Clean Air Force are really focused on is ensuring that the health-based standards have a ample margin of safety to protect all Coloradans, not just the healthy working Coloradans, but everyone from little babies all the way up to senior and elderly who may have other health issues. Next slide, please. And these are some slides that are taken from CDPHE, or Colorado Department of Public Health and Environment's own slides. So how they're defining these slides is a benchmark concentration at which point there is likely minimal or no risk to public health. So it's going to be a concentration in the air, not just what is emitted from one source, but almost similar to the ozone, how we think about ozone standards in the Denver area, where if it gets too high, then it's considered unhealthy. And if it's lower than that, then we don't have an alert day for that air pollutant. Next slide, please. And all of these health-based standards are based on what is called toxicity values. So a toxicity value is developed by a whole bunch of different agencies, but particularly the EPA. And it's very much how toxic is this pollutant, and then what impacts does this pollutant have, which can be both cancer and non-cancer health risks. Next slide, please. So we want to define what is a health effect. So health effects, so detrimental health effects from exposures to emissions of an air toxic include the cumulative effects to health from exposure to combined air emissions from the toxic air contaminant. So this is what I'm saying is, it's not just the one source down the street, but it's the entirety of what you could be breathing in the air. And it relates to multiple sources of emissions that routinely, intermittently, or accidentally release these air toxics. So if, let's say, a refinery has a big emission event, that may not be health protective. I apologize for my dogs. Next slide, please. And what we're talking about, the specific values, we want to think about the risk. And when we're talking about risk, there is both cancer risk and non-cancer risk. Next slide, please. Specifically for cancer risk levels, the Air Pollution Control Division is proposing in the rulemaking that the cancer risk level be set to 1 in 1 million excess cancer risks from a particular air toxic. And this is something that a lot of the environmental groups are supportive of. Industry parties, such as the Colorado Oil and Gas Association, are trying to increase that to 100 in a million cancer risk. A lot of Coloradans, the levels of pollutants that they're exposed to, for instance, for benzene, is around 4 in a million cancer risk. So it would really not be health protective as people are having health concerns at that level. Next slide, please. So non-cancer risks are a little bit more complicated. How the division really describes it is a threshold. So instead of it being, 1 in a million cancer risk, you're thinking about how likely is someone to have health effects from this specific air toxic. So how you describe it can be, you have a kid holding a balloon. As the balloon gets bigger, that health quotient gets bigger. So when a health quotient equals 1, that's at the point where the person is lifted off the ground due to the balloon. And that's the point where health effects may occur. However, next slide, we are exposed to not just one pollutant, but a whole bunch of pollutants. So it's kind of like holding a whole bunch of balloons, because all of these pollutants can impact your lungs and could potentially cause you to have issues with asthma or other respiratory diseases. So as you add up all of these various pollutants, you get a cumulative risk, which could then make you raise off the ground from the balloons lifting you off the ground. Next slide. So what we're saying is really, this extra lifting off the ground, these multiple pollutants accumulate the health risks. Next slide. So really what the division is proposing is a non-cancer health risk of 0.3. So 1 is the level that there may or may not be health risks. 0.3, they're using as a protective safety factor. So you could have multiple balloons and still stay on the ground. Environmental Defense Fund, who is also a party to this rulemaking, is actually proposing a non-cancer risk value of 0.2. And this is because there's a lot of complicated math, but how the variability between people that the EPA recommends is about 10 times. So like one person being exposed to one may be the same impact as a different person being exposed to 10. But other studies show that it actually has a lot more variety between people. So a little baby or a little child being exposed to one may be equivalent to an adult being exposed to 40. So there's a much wider range. So a lot of us are actually supporting a lower non-cancer risk level. Next slide. So just an overview of really what's happened in this rulemaking and where we're going is in January, the Air Quality Control Commission adopted those 5 priority air toxics. In May, they set this rulemaking for health-based standards that is now going to be occurring in September. So all of the formal parties to the rulemaking are currently participating in the process and developing our stances on what's going on. And community members can also provide written or public comment, and then which we'll talk about later in this presentation. Another really important thing you all might be interested in is learning about the permit gap analysis, which is really how these health-based standards will be utilized in policy and regulation around permits. And that is not part of this rulemaking, but we will likely have another webinar in the future discussing the permit gap analysis once the Air Pollution Control Division releases that to the public. And with that, I will pass it back to Tykee.
Thank you so much, Tehya. Folks, make some noise wherever you are. That was a lot of great information in such a short amount of time. So if you do have questions, please put them in the Q&A portion of the Zoom, and we will get to those questions towards the end. Now I have the honor of introducing our next speaker, Dr. Maria. As a family physician with expertise in climate medicine, she serves as the vice chair of the American Academy of Family Physicians Climate and Environmental Health Group. With Harvard credentials, Colorado training, and that good home feeling of a mountain town, she brings valuable insight to this rulemaking to address our air quality challenges. Maria, always great working with you. You have the floor.
Thank you, Tykee, for that kind introduction. And good evening, everyone. Thank you for joining us. Next slide. So many of you might wonder how much of an issue air quality actually is in Colorado, where we are known for our pristine wilderness and mountain air. This chart shows the air quality grades that were given to 22 Colorado counties by the American Lung Association on their State of the Air report card. This report card grades air quality, particularly based on the number of high or unsafe ozone days. 22 of the 64 counties in Colorado provided enough data to grade them. 14 of them, or approximately 2/3, failed. This answers the question, air quality in Colorado is a very significant problem. Next slide, please. I want to take you through the 5 selected toxic air contaminants and briefly describe the specific cancerous and non-cancerous health risks and issues that they may cause. First is formaldehyde. Formaldehyde is very irritating. It tends to irritate the upper respiratory system. It causes a lot of irritation of the eyes, nose, throat, airways, and skin. It also has cancer implications. It does increase the risk of leukemia death among workers who are exposed regularly to formaldehyde. Next slide, please. Hydrogen sulfide is what's known as a broad spectrum toxicant. This means that it affects the mucous membranes, which is the pinkish tissue inside the nostrils, the mouth, the throat, and the organs that are high in oxygen demand, including lungs, heart, brain. It has a lot of neurological side effects. It can cause confusion, memory issues, headaches, hallucinations. It also can cause heart impacts, cardiovascular impacts, specifically low blood pressure, and it can cause digestive impacts with appetite loss. Next slide, please. Ethylene oxide is particularly high with cancer risks. It is associated with a higher risk of leukemia, which is blood cancer, lymphoma, which is bone cancer, and breast cancer. It is particularly harmful to people who have career exposures to ethylene oxide. For people who have a 35-year career with regular exposure to ethylene oxide, of those folks, 1 in 17 will develop a cancer. It also has reproductive impacts, which are particularly concerning for female employees and can lead to miscarriages. Next slide, please. Hexavalent chromium is significant for causing a lot of respiratory effects. It can cause asthma, it can cause lung damage, it can exacerbate those health problems in people who already have them. It can affect the mucous membranes again. It can actually cause ulcerations, which are sores or erosions in the nostrils. Sometimes those erosions develop to the point where people actually develop a hole between their nostrils. It can cause eye damage, can cause conjunctivitis, which is inflammation of the coating of the eye. It can lead to ruptured eardrums, can cause significant tooth damage and tooth decay. It can have also internal effects. It can lead to abdominal pain, kidney and liver disease. It's also associated with higher cancer risks, specifically lung, nasal, and sinus cancers. Next slide, please. Benzene also has a strong association with cancers. There's an elevated risk of leukemia with benzene exposure. It also has multiple other impacts on the blood. It can cause anemia, which is a low blood count that can contribute to fatigue and low energy. It can also impact our ability to clot in the blood, causing bleeding tendencies, and it can weaken the immune system, making people more susceptible to infections, making it harder for people to fight off infections. It can contribute to reproductive issues, including the development of a fetus. It can contribute to low birth weight and bone marrow damage. As was mentioned earlier, many of these chemicals are emitted in similar locations, so individuals who live and work in specific neighborhoods may be exposed to multiple of the toxic air contaminants. The impacts of these exposures can be additive, so that people experience worse impacts when they're exposed to multiple chemicals. For example, benzene causes a tendency to bleed, and hexavalent chromium can cause ulcerations or wounds in the nostrils and eardrums. So exposure to both of these can have additive effects, including severe bleeding from the nose and the ears. Next slide, please. In addition to the immediate impacts of the 5 toxic air contaminants, there are also long-term secondary impacts on our health. 3 of the toxic air contaminants, specifically benzene, ethylene oxide, and formaldehyde, are what's known as volatile organic components, or VOCs. The VOCs react with nitrous oxide, which is a chemical that is commonly emitted by gas engines, such as our cars. And when these are together heated by sunlight, they produce ozone, which is basically smog. I'm sure you've all appreciated the haziness of the Denver skyline on a bad smog day. Ozone itself has significant health impacts, including coughing and irritation of the ears, nose, and throat. Severe impacts of ozone on our health include chest pain, breathing difficulty, asthma attacks, chronic lung disease, heart disease, and can even contribute to premature death. The bottom line is that the higher level of toxic air contaminants leads to higher levels of ozone, which leads to more common and more severe health problems. What do the health issues associated with ozone look like in Colorado? Specifically, heart attacks and strokes are significantly more common 4 to 5 days after a high ozone bad air quality day. Every 1% increase in ozone leads to a 1% increase in outpatient cardiac arrests, which is when the heart stops outside of the hospital. Even at concentrations that are significantly below the EPA air quality standards, this is a problem. For 40 days last summer, in the summer of 2024, the northern Front Range counties exceeded the EPA ozone standards. So this is becoming a regular event. Air quality in our state has actually deteriorated to the point that in 2022, the EPA reclassified the Denver Metro North Front Range as a severe non-attainment area under the 2008 ozone standards. So unfortunately, this is becoming a worse problem over time. Another long-term impact of the toxic air contaminants is more heat. Ozone in the higher levels of the atmosphere actually protects us from the harmful rays of the sun and can protect us against skin cancers. When ozone is in the lower levels of the atmosphere, it acts as a greenhouse gas and contributes to global warming. Formaldehyde, which is one of our 5 toxic air contaminants, also reacts in the atmosphere to form other compounds with climate effects. The Colorado Climate Report indicated that the average temperature in Colorado has risen 2.3 degrees Fahrenheit since 1980. If global temperatures rise by approximately 4 degrees Fahrenheit from pre-industrial times, the annual number of heat-related deaths may increase almost 5-fold. This is a very significant jump. Heat stress exacerbates underlying illnesses such as cardiovascular disease, mental health problems, asthma, and kidney disease. Deaths from heart attacks or strokes may be 2 to 3 times more likely in the context of extreme heat. Increasing temperatures are also associated with a higher risk of accidents, air pollution, food insecurity, and transmission of multiple different infections. At particular risk are pregnant women, young children, elderly adults, people with underlying health conditions, people who are overweight or obese, and outdoor workers. The impact on outdoor workers is particularly significant for us in Colorado. The U.S. Bureau of Labor Statistics notes that across the U.S., almost 33% of employees have regular outdoor exposure as part of their work, which puts them at particular risk for extreme heat. With our significant emphasis on farming, ranching, the oil and gas industry, building, and outdoor recreation, this number may be even higher in Colorado. These are jobs that are held by many of us and many of our family members. Next slide, please. What communities in Colorado are at the highest risk from the toxic air contaminants? Looking at this map, the little black dots are oil and gas facilities. The yellow surrounding areas are called the threat radius. These are regions within 1 mile of gas or oil facilities, which are considered the highest risk areas. The color of the counties represents air quality, with darker colors representing worse air quality. You can see that the 3 worst air regions by far include the Denver-Boulder corridor, a large patch in the western part of the state, which happens to be my home, and the southwest corner of the state. These are darker red in color, reflecting poorer air quality. They do contain a significant amount of black dots and yellow threat radius terrain. What do the actual numbers look like? There are 50,607 oil and gas facilities in Colorado, creating a total threat radius that covers 6,034 square miles. Almost 300,000 to 400,000 people live within a threat radius zone. This includes almost 40,000 students. These are our young people who are particularly susceptible to the impacts of these toxic air contaminants, and includes more than 75,000 people of color. Of note, the populations in the threat radius are growing faster than other communities in Colorado are growing. Also at particular risk are oil and gas workers. In March of 2022, there were 2,475 oil and gas jobs in Colorado. These are 20,475 individuals who are at higher risk for the health repercussions of exposure to these 5 toxic air contaminants. What does the risk look like inside this threat radius? The lifetime cancer risk of individuals living within 500 feet of a well was 8 times higher than the EPA's upper level risk threshold. A study by the Colorado School of Public Health determined that Colorado children diagnosed with blood and bone cancer were more likely to live near oil and gas wells. Another study found that older adults and women with atrial fibrillation, which is an abnormally fast and irregular heartbeat, had significantly more exacerbations when they lived within 0.8 of a mile of an oil or gas well. Next slide, please. Who is at particular risk? The folks who are at particular risk are seniors, are elderly folks, children, people who have heart disease, people with lung conditions, pregnant women, oil and gas workers, outdoor workers, and as we discussed, residents living within 1 mile of the emitting facilities. Next slide, please. So what can we do to help? There's a number of things that we can do kind of at all stages of this process, as far as impacting the concentrations of the toxic air contaminants. We can reduce driving, particularly on hot days. By reducing driving, using public transportation, we can reduce emissions. Again, emissions on hot days are particularly harmful to the ozone creation, which is provoked when emissions from our cars mix with the toxic air contaminants. Walking or biking is also great exercise and helps prevent heart disease and diabetes. So lots of benefits by using other methods of transportation. If possible, we should try to compost so there's less organic trash going into the landfill to decrease emissions. If as much as possible, minimize electrical use at home so there's less demand on coal-fired power plants, which also have a significant impact on air quality. Simple things like turning off the lights and the TV when you leave a room makes a huge difference. We should advocate for air quality monitoring and reporting. We need to be mindful about the health problems that are impacted by poor air quality and make an effort to report them to the public health departments. It's much easier for folks in the medical profession and in the public health profession to track and analyze community impacts when we have the appropriate data. If you are having symptoms like what we spoke about today, get seen by a medical professional sooner rather than later. Health problems caused by exposure to toxins worsen with time. It's much easier to take care of health problems earlier when they're mild. Chest pain, shortness of breath, severe dehydration, and mental status changes are medical emergencies. If you're experiencing anything like that, call 911 or go to the emergency room. And as we're going to discuss with our next speaker, last but not least, provide comments to share your opinion on the importance of Regulation 30. It's absolutely critical that we develop and enforce science-based guidelines for emission levels that are tolerable to human health. Thank you very much.
Well done. Well done. A mic drop for Dr. Maria. Thank you so very much. Wow. Just taking that in. Now I would love to bring to the stage Shaina Oliver. It's my pleasure to introduce our next speaker. As a tribal member of the Navajo Nation from Shiprock, New Mexico, she serves as a field organizer for Moms Clean Air Force and Eco Madres. With firsthand experience in environmental justice, deep community connections, and I have to tell you, the strongest voice, any room I've ever been in with her, it's always her. She brings valuable insight to this discussion about how to bring public comment to the Air Quality Control Commission. Shaina, the stage is yours.
Thank you. Thank you, Tykee. Again, I am a field organizer with Moms Clean Air Force and outreach coordinator for Eco Madres, engaging on environmental justice, harmful pollution, and as well, importantly, our health. Importantly, I am a mom of 4, and we are enrolled members of the Navajo Nation, survivors of the Indian Removal Act, known to the Diné as the Long Walk of the Navajo. And Moms Clean Air Force acknowledges and honors the ancestral lands of 574 tribal nations that have ancestral ties to the lands that we know as the United States. And I work and reside on the ancestral lands of 48 tribal nations of Colorado. And next slide. So Moms Clean Air Force is a national organization of over 1.6 million moms and dads united against air pollution, including the urgent crisis of our changing climate. To protect our children's health, we fight for justice in every breath, recognizing the importance of equitable solutions in addressing air pollution and climate change. And next slide. So although the legislator and commissioners and parties to the rulemaking played an instrumental role, it is critical that voices of impacted residents are elevated. Your comments will be made to the air quality control commissioners who are appointed by the Polis administration to oversee air quality programs, adopt regulations, and work to reduce greenhouse gas and protect our air. So this is an important opportunity to make your voice heard and for the commissioners to hear and learn from impacted residents. Next slide. So telling your story through testimony. So telling your story will be the most important action you can make. Most public comment hearings allow you 2 to 3 minutes to speak, which is a word count of 125 to 150 for 2 minutes, and about 300 to 450 word count for 3 minutes. So preparing for your speech will be important to be clear and concise. You want to state your name, as well as what area you live in Colorado, state the problem and concern, stating who's the villain in your story, and lastly, state how what the issue, how the issue can be addressed and what the solution can be. And to remember to please give thanks to the commission for their time, as these are volunteer positions that we'll be speaking to and are taking their time to make these hearings possible for the public and the community to take engagement. So next slide. So important dates to mark your calendars for. September 2nd is when written comments are due by 5 p.m. Mountain Time. And you can email your public comments to cdphe.state.co.us. That is the email that you will refer your public comments on. September 2nd is the deadline for written comments. So remember to write in regulation 30 public comment in the subject line when you email your public comments to the Air Quality Control Commission. So make sure that you have that in the subject line before you send off your public comment. Copy and paste your comment in the note. And if you miss the written comment deadline, you can register at the link provided during our session, or the one provided that you see in the slide. You can access that link and register to make a oral comment on. So the oral hearing will happen between September 17th, 18th, and 19th. Sorry, and we'll try to reshare these on our platforms: Conservation Colorado, Healthy Water and Air, and Mom's Clean Air Force. Our platforms will be sharing this link after this webinar. Again, since we're having difficulties sharing it at the moment, but we will reshare this link so that you can register to make oral public comment for September 17th through the 19th. You'll be given, during that registration, you'll provide your personal information that will not be shared with anybody. It will be specifically for the hearings, so that they can send you the link to join the hearing for the hearing that's going on between the September 17th and 19th. And then you can select which times are best for you to give oral comment, either in the evening of the 17th, and I believe either the 18th or the 19th, you'll have another opportunity to speak during the mid-morning or early morning of the hearing to give public comment as well. So based on your availability as well, unfortunately. And again, you will have roughly 2 to 3 minutes to speak. So once you've registered, you will receive a notification that you registered, and you can save that link to your calendar, or you can copy and paste it to your calendar. Then the day of the public hearing, you will click to the link and join the hearing and wait for further directions from the commission. As well, you will keep your camera and your speaker on mute until it's your time to testify. So be sure to prepare yourself for public comment. Be sure to be in a quiet space that the commissioners can hear you clearly, and give yourself grace. We know that speaking your truth can be very scary and intimidating. So practicing giving your testimony ahead of time, and practice taking deep breaths and calm. It will help you calm down, calm your nerves down, and re-ground yourself before you give your public testimony, which can be very scary. Most importantly, share your story. How has harmful air toxins impacted your life, your families, or a loved one's health? Do you live with allergies, asthma, cancer? There's various things that can exacerbate your respiratory systems due to the toxins that we're intaking in our community, in our environment. And I know I know I said I was a field organizer for Colorado, but I do live in the Northeast Denver area where we have higher amounts of levels of ozone pollution, as well as like we don't know what we're breathing when it comes to air toxics, which is why this hearing is really important, because these are brand new laws to our state, and implementation of these at the state level is very important, that we ensure that your voices are heard at the community level, and that that we retain the health-based standards currently, and it should be strengthened and not weakened as proposed by the industry. And I yield my time for now, and I thank everybody for your time and making this time for us to share how you can take action.
Wonderful job. Outstanding. Can we bring all of our presenters back for preguntas? Questions. Really great work, y'all. I think we hit on the three really important things we want folks to take away. We want them to understand the rulemaking. We want them to understand how these air toxics affect them, and we want them to understand what they can do. And just to start with a question for all three of you, no particular order, but since you're off mute, how about Maria? Dr. Maria, you go first. What gives you hope that Colorado can successfully address its air quality challenges? And I'm going to ask that question to everybody after Dr. Maria.
Sure. So first of all, I don't think we have much of a choice. If you look at the short and long-term repercussions of the toxic air contaminants on our planet and on our health, we really don't have a choice. This is sort of an imperative. This is a necessary thing. So that gives me hope that we are wise enough as a species to figure that out and do something about it. But the second thing that gives me hope is the fact that all of you are here today, the fact that I have these illustrious colleagues to work with, the fact that people have this passion to educate others, to write the legislature, to speak in favor of the legislature. So I see things actually happening, and that is very encouraging.
Excellent. Thank you so much for that, Dr. Maria. Tehya, could you go next?
Yes, I think what gives me hope is that there's a whole bunch of community organizations as well, who I think some of them might be in the room today. Greenhouse Connection Center, Cultivando, and then other organizations like Environmental Defense Fund, who are all, with us working together on these regulations. I also think seeing Colorado actually pass laws in the past few years that are now starting to become implemented has been really great to see, and gives me hope that we can continue to strengthen and push the legislature even more in the future. And it's like, it just takes time, but I think that with everyone saying that we need this to happen, I think all our voices are really important, and it'll help change things.
Thank you so much for that. I totally feeling you. Shaina, can you take us home with that question on what gives you hope for our future?
I think there's a lot of amazing younger generations that, are learning way more about how to, create a pathway for a livable planet. And I'm surprised that, I'm coming across young learners that are already, somewhat ahead of the game when it comes to knowing environmental skills that we just don't understand yet, as we were never taught that in our school. But I'm glad the younger generations education is providing that knowledge to our students, and reiterating some of the things that, environmental, climate action needs right now. And, I'm thankful for those young generations that are stepping it up and, surpassing our knowledge as those that have been, been putting our foot on the ground on these actions for air quality, as well as environmental health, and public health, and how that's making a full circle, in our discussions in our communities, and people are making those connections. So it gives me hope that, we have professionals on this panel that are speaking up about this, because, we never seen that before, where we had, we had that voice, especially as environmental professionals that are able to share that knowledge with us. So I thank you guys for, sharing that knowledge with me, and we are blossoming with the work that we do. So that gives me hope as well.
Thank you so much for that. And I want to remind folks, we're still accepting questions. Feel free to ask English or Spanish. We're happy to hear any questions that you may have about any particular issue, or if you want to hear someone's specific perspective, just please let us know. I have one more question, or not one more question. I have a follow-up question, this time just for Dr. Maria. What are the most common health issues you see with patients that you believe are linked to Colorado's air quality issues?
The ones that are most easily identified as being related to the air quality issues are lung problems. I see a pretty impressive amount of asthma exacerbations and COPD exacerbations in folks when the air quality is poor. And that may stem from the 5 toxic air contaminants, that might stem from other issues associated with climate change and global warming, such as increased pollen and increased asthma attacks. I do see a lot more people who have both asthma and allergies triggered by pollen. I see more people with chronic heart disease. So those are some of the impacts that I see most strongly.
Thank you for that. And audience members, we welcome any follow-up questions that you have, or if there was a particular slide you want us to go back to look at something. And my next question this time is for Shaina. Shaina, how has your community engagement influenced your advocacy efforts, whether it's with Moms Clean Air Force or Eco Madres or any umbrella you've worked under? How does that community engagement inform that advocacy?
My advocacy work, I engaged because I, as a Native American and enrolled tribal member, I knew my voice wasn't being heard in these spaces. When I first started advocating, a lot of times there was a lot of retirees in these spaces, and predominantly, white affluent participants that were involved in these, giving public testimonies and for our communities. Which I appreciate that, but I didn't hear my own voice in a lot of these spaces. So, that's why I encourage you to share your voice, whoever you may be, and to share your health experience, because we all have different health experiences. And, my story is unique to me. So, I really, I'm really amazed about like Moms Clean Air Force organization, how, they really influenced me to tell my own voice, and to be, to really focus on my own story and my own voice, and how I've been impacted environmentally, because I do have asthma. My youngest child does have asthma. He's one of the ones that's more prone to allergies as well. Well, basically all my family, we all have allergies at different times, and I probably get impacted the most when allergy season comes around. And not just that, like the air quality can impact your allergies as well as your asthma, as well too. And that's, sharing your voice is really important in that unique way. Just remember that you are unique individually. And that's what I really strive for people to share their own story, and to, be proud of your own story and how it can contribute to making change for our communities. As a tribal member, we're, from the Navajo Nation, we've experienced a lot of environmental harm on our lands, just as tribal members, period, for the US, that there's a lot of, environmental changes that have changed our health in our communities as tribal members. We have higher rates of asthma, cancer, diabetes, mental health, as well as premature deaths, and as well as adverse birth outcomes. Our maternal health is probably the least talked about in these circles, especially when it comes to decision makers, that, they tend to forget about our maternal health is also connected to our baby's health and our children's health. So, that's really where, driving that needle for change really encouraged me to make advocacy, and, to encourage people to tell their story. Everyone has a unique story, so don't be shy to share it, because you might be able to change legislation processes in your state or for your community. So those are the things that, keeps me driving forward and continue advocating, because, no one's going to tell your story better than you.
Incredible. Thank you, Shaina. I have two questions. One's specific for Tehya, and then one to finish out with the whole group. We'll go Tehya, Dr. Maria, and then finish with Shaina, and then we'll call it an evening. First, Tehya, the specific question for you, and then I'll give you the question for everybody, just so you can answer both. Tehya, how has your research on air toxics changed your personal habits or lifestyle? And then the question that I'll ask for everybody is, what do you plan to say to the commission on health-based standards? And, keep it really short since we're coming in on time.
Yeah, so answering the first question, before I started, grad school and stuff, I really hadn't thought that much about air pollution, besides just knowing that there are certain places where it's significantly worse than others, or like a wildfire event and things like that. Like Shaina, I actually also have asthma. I was diagnosed with asthma after getting COVID and developing long COVID. So that's also made me a lot more cautious about the air pollution. And I think for these air toxics specifically, when I have something smelly, or there's formaldehyde or something, I end up getting a massive rash on my face. You start realizing, you kind of start linking the smells and the sensations in your body to what physical symptoms you have when you start learning about what the various air toxics and other air pollutants can do. And it really helps you learn how to, avoid certain times of day, make sure that you're actually taking your inhaler like your doctor says that you should. Cooking with air cleaner, making sure that, you're not exercising at the highest peak of ozone during the day. There's a lot of things that you can do individually to at least reduce your own exposure, but reducing your own exposure only goes so far. And it's also really important to talk with the people who are in charge, and actually get laws passed and regulations passed to make things better. I've been doing a lot of additional monitoring in Adams County. So we're trying to figure out how to get more funding to do additional monitoring in the areas we know have higher air toxics, to understand how people are, what health experiences people are experiencing, and what levels of pollution that they're experiencing. So we're hoping to getting that funded soon. And really what I plan on saying to the commission is, people are exposed to, a whole bunch of things. Air toxics is one of them. And all of these things have a cumulative impact on what you're feeling and the health impacts that you have. It is not just enough to set a standard low for thinking about one pollutant, but as I showed with those balloons, we're breathing in a lot of things at one time. And the standards, health-based standards, should be actually health protective and be low enough to at least begin to address some of the uncertainties that come with breathing in multiple pollutants.
Thank you for that. I know we hit 7 p.m., so if you could just stay on for just a minute more so we can hear what Dr. Maria will say to the commission and what Shaina plans to say to the commission, and then we will close out. So please, Dr. Maria.
Sure. Much of what I plan to say is the information that I presented tonight, because I think that the biggest, one of the big impacts is on our health. And if people understand how widespread that health impact is, it's easier to make the right decision and do the right things as far as selecting science and evidence-based legislature and cutoffs to protect our atmosphere and protect ourselves and our children, our families. The other thing that's important is that one of the sad realities is that if something doesn't make financial sense, it's going to be less likely to actually happen. So one thing that I intend to point out is the financial impacts of these toxic air contaminants, as far as increasing the number of missed days from work, as far as missing days from school, as far as people feeling unwell and being sluggish and less productive at their work, people needing to purchase protective equipment such as face masks, respirator masks. These expenses add up. Also missed tourism from tourists not coming to Colorado because of the air quality days. That impacts our outdoor activities. So these things add up, and approaching it from a financial point of view, it is a sad reality, but that's a way to get things done and approved.
Thank you for that, Dr. Maria. And Shaina, take us out. What are you going to say to the commission?
I'm going to reiterate that, supporting Reg 30 is to set base standards as required by House Bill 22-1244, the public protections from toxic air contaminants. That's a good resource to look at, and, how we came to where we're at today, especially to remind the commissioners, what's at stake and why it's important for them to move forward for what we fought for in 2022, which is we're making history by doing this as well, and then reiterating that we do have a terrible ozone problem here in the Denver metro area. We're still the sixth worst city in this area to breathe in due to ozone smog pollution. Among that is these air toxics that we don't really know how much is getting into our bodies. So we do, according to the CDC reports, over 500,000 Coloradans are asthmatic. And that includes me, you, and whoever else is asthmatic in the state. And and those are our challenges across the Rocky Mountains on the eastern slopes of the Rockies, that we have to combat these due to our our state being the second leading in extracting oil and gas as well. But we do also have contributors like gas power plants as well, and transportation are just some of the things that are impacting our region here in Colorado. So it doesn't help when we have a administration currently that is allowing a bypass to our Clean Air Act for industries to, just make a simple email and say, I would like to be exempt. So this state bill is important to combat those rollbacks that we are constantly at odds with right now. So every action we can make at the state level is very important. So, and we do want to support Reg 30 to set health-based standards without limiting the scope of the health-based standards. So that's an important highlight that Tehya has given us to her expertise on these things as well, that we do need to reiterate cumulative impacts and aggregate. Those two words are very important to add to your statement that we, you know, and as well, you know, we want them to account for all the cumulative impacts that we are faced in our communities, and to account that in their aggregate. How do you say it, Tykee?
You got it. You got it. Aggregate. Yeah.
And it's like, I don't know, it sounds a little twisty now.
Totally
So
fair.
we can end with tongue twisters.
Well, thank you, Shaina, for the powerful words. Thank you, Tehya and Dr. Maria. Really, really appreciate everything here. Remember, folks, this will be sent out to you, the presentation, the recording with the interpretation, the link to register, to apply public comment to the commission. We hope to see you there. We hope to have you there. If you have any questions, my email is also in this presentation. I'd be happy to work with you in English or in Spanish to figure out how to make sure your voice is heard to the Air Quality Control Commission. And with that, I will leave you with this. Remember that your voice matters in this fight for clean air in Colorado. It's not just for ourselves, but for every child that deserves to run outside without struggling to breathe unless they're really, really good at playing tag. This is for every family living near those facilities who don't want those in the family reunion pictures for generations to come, who will not just inherit those bad pictures, but the bad air that we're choosing to try to protect today. Thank you again, everybody, for logging in. Hope you have a great rest of your evening.